Now examining the knee region. Again, inspection, palpation, movement, or look, feel, and move. By inspecting the knees, we inspect the skin for any skin rash, erythema, scars. We inspect here the knees. It's a common site for rheumatoid nodule, for any swelling. By inspection, there is swelling in the medial dimple. As you see here, there is ballooning of the medial dimple. Here also, but the left side is more. And this is the lateral dimple. Also, there is fullness in the lateral dimple. And this is the lateral dimple. This is the medial dimple, ballooned. There is some wasting in the muscles of the thigh. Also in inspection, we will try to find any relation between both knees. We may find genovarus deformities in osteoarthritis or a valgus deformity. Here, this is a normal relation between both knees. On palpation, I will palpate for hotness, any hotness. There is bilateral hotness at both knees. Regarding the palpation, for, as we told before, it is for hotness and for tenderness and for the swelling. اتني رجلك شوية كده. I will palpate for any tenderness around the joint capsule. Here I am palpating the joint line on the tibial bony prominence. في أي وجع كده؟ There is tenderness all over the knee joint. هنا في وجع؟ and palpate the other side. في أي وجع كده؟ Palpating on the tibial bony prominence and on the knee joint capsule for any tenderness, any hotness, any erythema. All these indicates active arthritis. So there is bilateral tenderness on the hotness and swelling with fullness of the medial dimple bilaterally more on the left side. On palpation of the knee, there are two special tests. The patellar tap test for moderate to marked effusion and the massage test for minimal effusion, to detect minimal effusion. Regarding the patellar tap test, we will feel the patella first. This is the patella. Here I will press the effusion. I will press the suprapatellar pouch and pressing by the index and the middle finger on the patella, trying to feel the ballotment of the patella in marked effusion. The idea of the massage test, here I will do massage of the medial dimple, one directional movement, then squeezing the lateral side, back again, squeezing the lateral side by continuous semicircular movement, and you will see this ballooning of the medial dimple reappear again. Massage test, massaging the medial dimple first, so we will lead this effusion or this fluid to move away, then squeezing the lateral side of the knee and observing for reballooning of the medial dimple. This is the massage test. Now, the movement of the knee joint, it is like flexion and extension. He can't extend his knee fully. Here in the popliteal fossa, I can feel the Baker's cyst, this swelling in the popliteal fossa due to herniation of the synovial membrane of the knee joint. This is a common deformity in aggressive rheumatoid knee, the Baker's cyst swelling in the popliteal fossa. Here the Baker's cyst in the right side, but here there is no Baker's cyst. I will show you the Baker's cyst. This on inspection of the popliteal fossa from behind, as you see here, this is the swelling of the Baker's cyst. Compared to the other side, this is normal, and this is the swelling of the Baker's cyst, herniation of the synovial fluid of the knee joint. So regarding the movement of the knee, we will do flexion. The patient can't flex his knee except to this level, and extension, also he can't extend his knee fully. There is an angle here. He should do complete extension, complete flexion. While doing the flexion and the extension, I will try now to feel the crepitus by this hand, to feel the crepitus of secondary osteoarthritis of the knee. Also this side. I can feel the crepitus of cartilage damage due to secondary osteoarthritis of the knee. تعرف تتني رجلك كده لوحدك؟ لا، واحدة واحدة من فضلك. افردها تاني. طيب. اتني الرجل دي للآخر، على الآخر، اتنيها على آخر ما تقدر. دي آخر حاجة. طب افردها. تمام. There is limitation in both flexion and extension of the knee, and there is crepitus bilaterally due to secondary osteoarthritis. Thank you.